हेलो एवरीवन, वेलकम टू पीडियाट्रिक्स बाय डॉक्टर आनंद एंड कैसे हैं आप सब लोग? हाउ आर यू? हाउ इज एवरीवन? टुडेज टॉपिक ऑफ चॉइस इज नथिंग बट रेस्पिरेटरी distress syndrome, RDS. We have RDS is divided into part 1 and part 2. This 1 hour is part 1. And today night, what time today night? Today at around 8:40 p.m. we have RDS part 2. Okay, respiratory distress syndrome. Hello everyone, welcome to Pediatrics by Dr. Anand. This is the Unacademy NEET PG platform. My name is Dr. Anand and we are here to rock Unacademy and we are here to rock Pediatrics. I want everyone to get a rank 1 in NEET PG March 2022. That's it. Okay. For the newcomers, my name is Dr. Anand. I'm MD Pediatrics. And please remember, in our beautiful Unacademy platform, we have something known as Plus subscription and we have something known as Iconic subscription. In the Plus subscription, you get all the amazing access to all my live and recorded classes because I have made them with a lot of hard work, and you get to study from best of the best educators all over the India. That is another best thing. And also you get all the you get to compete in the various live tests and quizzes, and also you can watch me on your Android, iOS, and also on your laptop. And amazing, we have the high yield most effective MCQs. It will be really helpful for you. This was the Plus subscription. In the Iconic subscription, you get the Unacademy what do you call subscription, as well as you get the prep ladder subscription, all the clinical questions, video lectures, question bank, rapid revision, dream notes. I mean, everything. You get everything possible on this platform. Also, for the newcomers, we have something known as special class feature. What is special class? Like, we have a app, an academy. Download that app. You can watch me there. There we can make MCQs poll over there, which you can't make on YouTube. You can raise your hand and ask your doubt. You never miss any of my classes because there in an academy we have all the recorded sessions. On YouTube you can't get a lecture notes PDF of my file, but in an academy you get the lecture notes also of everything whatever I teach, and also will make it as interactive as possible. And we have this most updated and highly effective question bank with all the latest exam patterns and detailed explanation. So it's a must and a must watch. And again, a big congratulations to all the our current NEET PG September 2021 toppers, all the top ranker students we have, and our next 12th March NEET PG 2022. Our target will be the students who are regular in my classes. Our Hamid, our Isha Srivastav, Ishita, Shubhangi, and Combat. So many amazing people we have. We want their names to be there. Okay. And we have this Unacademy Medical PG test for December. We already have full enrollments for the free test. Every Wednesday we are having a free test. I mean, you are totally welcome to attend them. And also we have made a batch for the next target, next integrated system wise batch 2023. In that one, again, we're going to talk about very important system wise test series which will be helpful and depth coverage of every topic. So it's going to be awesome. And we have already made a batch for this target NEET PG 2022, which is already starting from 8 December and which is duration for 4 months. For 4 months. Okay, so that was all about the Plus subscription and the Iconic subscription. It is based on the month wise. And again, if you want little relief in the finance, you can use this code and it will be little financially benefit for you if you want to take the whole app. So let's start everyone. So yes, are you with me? Yes or no? Yes, we have amazing students who are now ready. Okay, so today's topic is nothing but neonatology. The subtopic is hyaline membrane disease. Hyaline membrane disease, or nothing but respiratory distress syndrome. Okay, great. Now, point number one, always whenever I start a beautiful lecture, we always have this motivating quote. So today's motivating quote for the topic is nothing but, if you never heal from what hurt you, if you never heal from what hurt you, then you will bleed on people who did not cut you. So it's a very beautiful, very nice, motivating quote. I'll repeat again. If you never heal from what hurt you, then you will bleed on people who did not cut you. So the moral of the story is, past is a past, future will be a future, live on today, because that
मोटी रोटी पड़ी थी बन्नी को दे दी थी
हाँ. Okay, so please remember, very importantly, if you never heal from what hurt you, then you will bleed on people who did not cut you. So past is a past, future will be a future. Live on today, live on the present. Okay, whatever has happened, if you could not clear an exam, you could not clear an exam, leave it ahead, leave it. If you just heal from that, just heal from whatever happened. Just think about today and think about tomorrow. Don't create a fuss, don't confuse your life. There is a saying, don't be bitter by past, be better by past. Don't be bitter by past, be better by past. Learn from your experiences. Don't create a fuss that, oh my god, I am only sad, god has chosen me only to be sad, I am struggling. Everyone is struggling, just work hard, that's it, nothing else. Okay, so today's topic of choice is nothing but respiratory distress syndrome. So are you with me, everyone? I'm going to ask you a lot of questions. This respiratory distress syndrome, point number one, is also known as hyaline membrane disease. It is also known as hyaline membrane disease. Respiratory distress syndrome is also known as hyaline membrane disease. Now what exactly happens here? Let's start the whole topic. 1 day old baby. Okay, I have now, you have to put the answers in the comment section. 1 day old baby who is 30 weeker, born normal vaginal delivery, came with distress. एक बच्चा है 30 हफ्ते का है, मतलब what is preterm, anyone? Preterm is less than how many weeks? Preterm is less than 37 week, yes or no? So less than 37 weeker is a preterm. This baby is 30 week old. This baby is 30 week old, right? So yes, so the question is that only if a preterm baby has come to you with distress, a born normal vaginal delivery came to you with distress, so how do you approach? Please put your answers in the comment section. Anyone? एक बच्चा है, distress है. So what is the commonest cause? Like why such a small baby is having distress? Can anyone put message in the comment section? Why this baby is having distress? Any random guesses, anyone? Why this baby is having distress? So as, yes, very good. So as we all know, more the baby is a pretermer, they will be there. Yes, very good. Faiz Ibrahim, very nice. So more the baby is a pretermer, there will be chances that the baby's lungs would not be mature enough, in the lungs. What I'm trying to understand is something known as surfactant. Have you heard the name of surfactant? So surfactant is basically present in the alveoli of the lungs. I'll repeat again. 1 day old baby, 30 weeker only. Normal delivery baby was, but baby was having distress. So how do you approach, or what do you think is the cause? So one of the commonest cause of a preterm baby having distress is nothing but respiratory distress syndrome. Yes or no? RDS, you might have heard the name. What happens in RDS, sir? There is surfactant deficiency. What is surfactant? Surfactant basically, it is present in the alveoli of the lungs. What is the role of surfactant? Surfactant helps in keeping the alveoli patent. So once there is deficiency of surfactant, alveoli will not be patent, and that will lead to distress. Yes or no? Did you understand that much? Very good, Faiz. Very good, Paramjeet Kaur. So that's what. So surfactant deficiency is one thing which I roughly understand from this slide. Okay, more the baby is a pretermer, there will be surfactant deficiency, because surfactant helps in opening of alveoli. When surfactant is not there, my alveoli will not open, leading to distress. Okay, perfect. Very good, Faiz Ibrahim. Very, very, very good. Now we have to divide this. Now listen carefully. Now, very important, the cause of distress. This is a very beautiful slide. The baby is having distress. बच्चे को distress है. Now this distress could be because of other reasons also. For example, it is divided into upper airway obstruction, lung parenchymal disease, developmental disorder, and non-pulmonary causes. So upper airway obstruction. Can anyone tell me any one entity of upper airway obstruction in a child which can lead to distress? Anyone? Faiz, परमजीत, अपर एयरवे ऑब्स्ट्रक्शन में क्या क्या आता है, क्या क्या आता है अपर एयरवे ऑब्स्ट्रक्शन में? एनी रैंडम गेसेस? यस, ओके, फाइज सेज लरिंगो मलेशिया। वेरी गुड, आज फाइज बहुत आंसर कर रहा है। डेफिनेटली फाइज विल गेट अ पीजी सीट, देयर इज नो डाउट अबाउट इट। द मोर you participate, your chances are too much to have a PG seat. The one who are just listening will always be just listening only. Okay, so upper airway obstruction, one of the important cause, yes, we need to understand, is nothing but choanal atresia. Very 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 important first star mark NEET PG question. One of the important cause, yes, Anshu is answering, very good Anshu. So choanal atresia मतलब क्या होता है सर, क्या होता है choanal atresia? Have you seen this? Can we see that if I pass a nasogastric tube, if I pass a nasogastric tube, there will be obstruction. Failure to pass a nasogastric tube, failure to pass a nasogastric tube, but easy to pass a orogastric tube, easy to pass a orogastric tube, and failure to pass a nasogastric tube. So what will you think of? We'll think of choanal atresia. Choanal atresia. Okay, that's what. So this is a case of choanal atresia where there is a bone blockage. Can we see that the bone blockage? Very good. So this is nothing but a case of choanal atresia. It can cause, naturally it can cause distress in a child. Okay, I'll repeat again. What are we studying? Neonatology. Which subtopic? Respiratory distress syndrome. Which babies do you see? Do you see distress in preterms, terms, or post-term? The answer is, of course, preterm. Why? Surfactant deficiency, sir. Surfactant helps in breathing. No surfactant, no breathing. Baby will have distress. Other than the what you called causes of distress, like this one HMD, can you tell me any other cause? Choanal atresia, right? Failure to pass a nasogastric tube and easy to pass a orogastric tube. That's a NEET PG question. The answer is choanal atresia. Now, second, the other important cause in upper airway obstruction causing distress, number one is choanal atresia, and number two is something about an oral cavity. See, you have to, my ophtha HOD always used to say, whenever you are explaining something, explain from cephal to caudal or proximal to distal. So cephal to caudal, ऊपर से नीचे. Number one is choanal atresia. You will go down macroglossia or micrognathia. Macroglossia or micrognathia. I'll give you a toffee. I'll give you a toffee if anyone can tell me. I'll give you a chocolate in if anyone can tell me macroglossia. Can you see in any syndrome? Macroglossia, have you seen in any syndrome? Tell me one syndrome where you see macroglossia. मैं मान जाऊंगा. And I have already taught in the previous classes also. Paramjeet, Anshu, Faiz, our Isha, Ishita, Shubhangi, what do you think? Combat, name one condition, one syndrome where you see macroglossia. Very good. So the answer is Beckwith-Weidman syndrome, dear. Have you heard of Beckwith-Weidman syndrome? One of the causes of large for gestational age babies. You can say cerebral gigantism. I'll repeat again. Yes, very good. Anshu is right. याद है कि नहीं याद? Macroglossia with microcephaly with hemihypertrophy of limbs with babies having increased incidence of Wilms tumor. Nothing but Beckwith-Weidman syndrome. Okay, micrognathia. Micrognathia मतलब small jaw. Micro मतलब small. Gnathia मतलब chin और jaw. Macroglossia is large tongue. Large tongue. Okay, and small chin is micrognathia. Can anyone tell me one syndrome where you see micrognathia? Any one syndrome? Micrognathia or retrognathia? Any? The name starts with P. Anyone? Shubhangi, Kaushik, Isha. Very good. So can you tell me any one syndrome which starts which the finding is micrognathia? It starts with C. The answer is Pierre-Robin syndrome. The answer is Pierre-Robin syndrome. So Pierre-Robin syndrome is one of the syndromes where you have micrognathia. Micrognathia. They have micrognathia, U-shaped cleft palate, and difficult back and mass ventilation. Again, right now I don't want to confuse you. Okay, so like at least I want your brain should be acclimatized with little names of syndromes, right? Syndromes एक ना एक दिन तुमको करने ही है, आज नहीं तो कल. So at least little you should know that if I ask you where do you see macroglossia, you should say Beckwith-Weidman syndrome. If I say where do you see micrognathia, you will say Pierre-Robin syndrome. Pierre-Robin syndrome. Okay, Shubhangi says sorry I am late, I was in college. It's okay Shubhangi, I can understand dear, but try to pay attention and finish this topic. It's a half an hour topic, let's finish it off. Okay, next, what are the other causes? What are we studying? We are studying causes of distress in a child. Okay, so the various causes of distress in a child are: number one, choanal atresia. Number two, oral cavity. If there is macroglossia, I will have distress. If I have a microgonathia, I will have distress. Then comes to neck and larynx. Neck, if I have a congenital goiter, then I have a distress. And larynx, if I have a laryngeal web, subglottic stenosis, or any paralysis, I will have a upper airway obstruction. I will have a upper airway obstruction. समझ में आ रहा नहीं आ रहा है ना? I'll repeat again. We are studying the various causes of distress. We are studying the causes of distress in a child. Okay, that was upper airway, upper airway. Lung parenchyma. Now अब lung की ही बात आ गई. In the lung parenchyma, one of the topic which we are gonna discuss is nothing but respiratory distress syndrome, and the baby will have a distress, and TTN. What is TTN? Anyone? And Shubhangi, TTN क्या होता है? Faiz, bro, what is TTN? Have you heard of? Yes, very good. Transient tachypnea of newborn. Yes, very good, very right. Transient tachypnea of newborn. It is one of the causes of distress in a term child. One of the important causes of distress in a term child is nothing but transient tachypnea of newborn. क्या होता है, क्यों होता है, कैसे होता है, ये this separately, it's a 1 hour topic which I'll be telling later. Okay, very good Faiz, bro, very good Paramjeet, Shubhangi. We have a new name, Rishikesh Chaudhary. Okay, no problem, very good. हाँ, कॉम्बैट हीलर ब्रो. लेट क्यों आया तू दीपक? दीपक यू आर लेट डियर. 15-20 minutes यू ऑलरेडी लेट. वाई? ठीक है. सो व्हाट आर वी स्टडिंग? Neonatology. Which topic? Respiratory distress syndrome. What are the other causes of distress in a newborn? Other than respiratory distress syndrome, other causes are like upper airway obstruction, nasal, oral cavity, neck, and larynx. Okay, like that. Lung parenchyma, we told, respiratory distress syndrome, transient tachypnea of newborn, and the other important cause again, if the baby has taken meconium, yes or no, everything, right? If the baby is a case of meconium aspiration syndrome, right, then of course the baby can have distress. So distress के हजार कारण होते हैं. Every HMD, meconium, TTN, everything will have a, these are the causes of distress. Okay. Now, very important, the other causes are, in general, you should know the names. Again, pneumonia also baby can cause distress. Any persistent pulmonary hypertension of newborn. These are the lung causes. And developmental disorder causes like congenital diaphragmatic hernia. If a baby is a case of CDH, the baby can land up into distress. Can anyone tell me any two important cause of CDH, like two important findings in a case of CDH? एक बच्चा एडमिट किया है, दीपक. एक बच्चा एडमिट किया. दीपक वॉज देयर विद मी नाइट ड्यूटी. दीपक सेड सर एक बच्चा एडमिट किया है सर, आई थिंक इट्स अ केस ऑफ डायफ्रैग्मेटिक हर्निया सर. सो आई वाज लाइक ब्रो, हाउ कैन यू से इट्स अ केस ऑफ डायफ्रैग्मेटिक हर्निया? दीपक डियर, व्हाट विल यू आंसर मी? हाउ डू यू लुक फॉर कंजेनाइटल diaphragmatic hernia? Congenital means by birth. Diaphragm which supplies the thorax from the abdomen, and hernia. क्लिनिकली कैसे पता चलेगा कि ये बच्चे को कंजीनाइटल डायफ्रैग्मेटिक हर्निया है? दीपक, व्हाट डू यू थिंक? Yes, very good, very good. Anshu, okay, yeah, very good. Faiz is right. Sir, it will be scaphoid shape abdomen. Scaphoid shape abdomen. Bowel sounds in the chest. Bowel sounds in the chest. That is one thing. On X-ray, of course, you will see congenital diaphragmatic hernia, scaphoid shape abdomen, and the baby will have distress. The baby will have distress. See, congenital means by birth. Diaphragm means diaphragm. Ka hernia ho gaya means all the intestinal contents have gone up and has compressed the lung. All the intestinal contents have gone up and has compressed the lungs, and that is nothing but that leading to lung hypoplasia. So that's I will have distress. I will have distress. So these are the causes of, these all are the causes of क्या कहते हैं, distress in a baby. So upper airway obstruction, lung parenchymal, developmental disorders, and can anyone tell me non-pulmonary causes of distress in a baby? Non-pulmonary distress है, but respiratory system is normal. Can anyone tell me any one cause? Ibrahim, Shubhangi, Faiz, bro, Faiz कैसे? Combat, Deepak, व्हाट आर द, एक बता दो नॉन पल्मोनरी कॉज. लंग्स इन्वॉल्व नहीं है, बच्चे को डिस्ट्रेस है. लंग्स इन्वॉल्व नहीं है, बेबी इज हैविंग डिस्ट्रेस. सो हैव यू हर्ड ऑफ कंजेस्टिव कार्डियक फेलियर, CCF? might be a case of congestive cardiac failure. So that's what, so that could be a non-pulmonary cause. And very good, yes, Faiz is telling right answer. CDH में Faiz is telling extra point that congenital diaphragmatic hernia, bag and mask is contraindicated. Okay, very good. That finishes this part. Okay. Did you understand this much, everyone? Yes or no? इतना समझ में आया कि नहीं आया? Did everyone understood this much, or should I repeat, everyone? Okay. Next. So, hyaline membrane disease or respiratory distress syndrome. बच्चा preterm baby है. He is having distress. What is the incidence, risk factors, etiology, and pathophysiology? So, incidence. So, what do you think? Is respiratory distress syndrome is common in preterms or common in terms baby? Which baby distress is more common? Of course, preterm baby distress is more common. So, very important. The incidence of what you call the RDS, of course, more than 37 weeker, it will be a rare thing. More than 37 weeker baby, you will not see RDS. Why? Lungs mature होते हैं. Lungs get mature properly. Now, lungs mature होते हैं. So, this comes to another a very important NEET PG question. When are you expecting the surfactant? When are you expecting the surfactant in the amniotic fluid? And when are you expecting the surfactant in the lungs? Anyone? When are you expecting the surfactant in the amniotic fluid, and when are you expecting the surfactant in the lungs? Anyone? Any random guesses? Yes. Remember 20, 28, and 35. These three numbers are very important. You expect the surfactant in the lungs in an immature form in the lungs by 20 weeks of life. Yes. Yes, that's very right. So we can, so I'll repeat again, surfactant is present in the lungs in the immature forms by 20 weeks period of gestation. In the amniotic fluid by 28 weeks, and in the mature levels in the lungs by 35 weeks, in the mature level. So any baby who is less than 35 weeker will have a distress, Are you understanding? Very good. These three are the exam question. Okay, star mark, and star mark. Surfactant is present in the immature levels in the lungs by 20 weeks of life, in the amniotic fluid by 28 weeks, and in the mature levels in the lungs by 35 weeks. And any baby, I told you, more than 37 weeker, he will not have a distress, right? His lungs will be fine. Okay, and as the weeks go down, the chances increases. Just remember, less than 28 weeker baby has 80% chance, that he will have a whiteout lung. Or he will have a kind of a that's what, distress. Okay, less than 28 weeker. Very good. Okay, what are the risk factors? It's a very simple, very happy topic, very easy it is. So what are we studying? Respiratory distress syndrome. And Anshu says, can we give DEXA to all pregnant mothers? Any side effects? Yes, Anshu, we can give DEXA to all the mothers, but the only contraindication of giving dexamethasone is chorioamnionitis. Chorioamnionitis. If the mother is a case of chorioamnionitis or a foul smelling liquor or chorioamnionitis, that's the absolute contraindication of giving steroids. Yeah, very good. So what are the risk factors? किन babies को white out lung होना या फिर ये hyaline membrane disease होना ज़्यादा लाजमी है? Number one, preterm, yes or no? The more the baby is yes, very good. The more the baby is a premature or preterm, he has more chances of what you called going into distress. Next, very important, other than preterm, yes, maternal diabetes. Please put a star mark. That's a fifth NEET PG question we are covering right now. Half an hour over, 20 minutes left. Okay, I'll repeat again. What are the risk factors of respiratory distress in a preterm? Number one, the more the baby is premature, he will have distress. The more the baby is of maternal diabetes. Remember, maternal diabetes interfere in the production of surfactant. Maternal diabetes interfere in the production of surfactant. So maternal diabetes is another risk factor. Next, very important, genetic factors. History of respiratory distress syndrome in the siblings or male sex. History of RDS in the family or the male sex. That's another risk factors. Then another very important after this, thoracic malformation. Even congenital diaphragmatic hernia also. The baby can have distress. Yes or no? Why, sir? Why? Because all the congenital diaphragmatic hernia, from the diaphragm, all the intestinal has herniated into the left side. It has already caused the lungs fully compressed. Lung ko to space ही नहीं है. The lungs are fully compressed now. So baby will have a distress. Yes or no? So baby will have a distress, right? Yeah, very good. And last but not the least, after prematurity, in diabetes, genetic factors, thoracic malformations, we have genetic disorders. What is this SPB and SPC? Surfactant protein B, surfactant protein C, gene mutations. Any mutation if you see, then lungs will not form. SP is surfactant protein. Surfactant protein B, surfactant protein C. समझ में आ रहा नहीं आ रहा? Is everyone understanding? Yes or no? Put a yes if you're understanding. Put a like button if you're understanding the concept. Okay. So I'll repeat again. What are we studying? We are studying nothing but respiratory distress syndrome. And respiratory distress syndrome, very important. It has multiple causes. Basically, RDS is cause is the lung cause, but could be any upper airway problem like guanal atresia, oral problem, neck problem, larynx problem, like that we studied. Then also we studied the more the baby is preterm, the more the chances it has of having distress. What are the risk factors of meconium of the hyaline membrane disease? So the main risk factors are, we have done that, our what you call prematurity, maternal diabetes, genetic factors, and thoracic malformations, and also very important our last genetic disorders, surfactant protein B, surfactant protein C deficiency. Okay, next. Yeah, what is the composition of surfactant? Who will tell me what is the composition of surfactant? What all points are there in surfactant? Can anyone tell me? Faiz, Isha, Isha has come, okay. Paramjeet, Shubhangi, yes. One of the important composition of surfactant is nothing but this one. Dipalmitidyl phosphatidyl choline, nothing but lecithin. The most important 68% surfactant is formed by this thing. Yes, exportin has come. Hey, exportin, what's up? Priyanka came. Everyone has come now. Okay, very good. So, yes, Isha Srivastav is right. So, the most important composition of surfactant is nothing but dipalmitidyl phosphatidyl choline. Dipalmitoyl phosphatidyl choline. ठीक है. So yes, so this is the one of the most important composition of the surfactant. It is known as lecithin. It is known as lecithin. So we have dipalmityl phosphatidyl choline, which is nothing but lecithin. Then phosphatidyl glycerol, ethanolamine, and inositol. These are the important composition of surfactant. And then we have surfactant protein A to surfactant protein D. Surfactant protein A से लेके surfactant protein D. समझ में आ गया? And again, NEET PG, this is the one with the most important composition factor. This L, lecithin. Okay, that's it. Okay, समझ में आ गया? Very good. Okay, next coming to West Bengal PG 2016 question. Lungs do not collapse. Lungs do not collapse during expiration. Like, see, we have inspiration, like we do inspiration, right? Inspiration. So alveoli swells up. So when we expirate, the alveoli deflate, but they never collapse. They never collapse. Why they never collapse? Because of the presence of dipalmityl phosphatidyl choline. Okay, that is the only reason they don't collapse, है ना? Yes or no? Isha is right, Priyanka is right. Combat has come. Combat लेट क्यों हो गए? हामिद, तुम कहाँ थे? हामिद, तुम भी लेट हो, कहाँ गए हुए थे? ठीक है, डन. नेक्स्ट क्वेश्चन. Okay, that's another NEET PG question today afternoon. Isha was telling surfactant is formed in the lungs by what cells of the lungs? Type 2 pneumocytes. Type 2 pneumocytes of the lungs. Surfactant is formed in the lungs by what? Type 1 or type 2? There are pneumocytes present in the lungs. So type 2 pneumocytes. Type 2 pneumocytes are responsible for this formation of surfactant. Okay, this part over. And then, yeah. And this is easy. This we have already done. Surfactant is present at 20 weeks of life in immature level of in the immature levels in the lungs. Number one. By 35 weeks of life, mature levels of surfactant are seen in the lungs, and it is seen in amniotic fluid by 28 to 32 weeks. By 28 to 32 weeks. Okay, so this was a recent question, 2016. Surfactant appears in the amniotic fluid by anyone? Question 70. Paramjeet, yes. Rishikesh, yes. Yes, very right. So surfactant appears in the amniotic fluid. Faiz, dear, amniotic fluid, it comes by 28 weeks. Amniotic fluid, Isha, yes, amniotic fluid 28 weeks, right, done. Okay. So again, what will happen? See, when there is surfactant deficiency, so surfactant, what is the function of surfactant? Surfactant basically helps in keeping the alveoli open. It helps in keeping the alveoli open. When once surfactant deficiency is there, alveoli is collapsed. When the alveoli are collapsed, what will happen? Once the alveoli is collapsed, my FRC will reduce. So alveoli, what is FRC, anyone? FRC is the functional residual capacity. Have you heard of functional residual capacity? Is equal to what and what, Ishita? दोपहर को हमने किया है. Yes, functional residual capacity will be nothing but expiratory reserve volume plus residual volume. Expiratory reserve volume, which is of 1200 ml, and residual volume, which is again of 1200 ml. Total FRC of the lung is nothing but 2400 ml. 2400 ml. I'll repeat again. What are we studying? Neonatology. Which topic? Hyaline membrane disease. Okay, it is also known as respiratory distress syndrome. What happens? मतलब मेनली टेल मी मोटा मोटा क्या होता है सर? सर्फेक्टेंट की डेफिशिएंसी हो जाती है. Surfactant is a deficiency of surfactant. What is the function of surfactant? It keeps the alveoli open. So once surfactant is not there, my alveoli are collapsed, and I will lead to distress, cyanosis, retractions, grunting, everything, right? Everything. So that's what. So to maintain the FRC of the lung, FRC is nothing but expiratory reserve volume and residual volume, which is nothing but 2400 ml. To maintain the FRC of the lung, I have to keep the alveoli open. This is a very beautiful picture. Can you see a tidal volume? Tidal volume कितना होता है ईशा? What is the normal tidal volume? Anyone? What is the normal tidal volume? See, this is the expiratory reserve volume. This is the residual volume, and दोनों को मिला के this is the functional residual capacity. So FRC is equal to ERV plus RV. See, the normal breath which I'm taking, that is tidal volume. And what is this? This is inspiratory reserve volume. मतलब when I'm taking a normal breath, the highest inspiratory breath which I took is inspiratory reserve volume. And after normal breath, the maximum I could take it out, that is expiratory reserve volume, and still something is left, that is the residual volume. And yes, Isha is right. Who else? Faiz is right, and Paramjeet is very right that our tidal volume is nothing but 500 ml. Yes, that's very true. Tidal volume is 500 ml. Okay, done. And again, remember, like, just a small quote: 5 things you will never recover in life. Keep studying hard. 5 things you will never recover in life: a stone after it's thrown, a word after it's said, an occasion after it's missed, time after it's gone, and trust after it's lost. These are the 5 things. These are the 5 things you will never recover in life. So make sure your trust, your time, your word really matters a lot. Okay, done. Yeah, again a very good question. Only this तो I think Ishita should answer, and Paramjeet. एक बच्चा admit किया. Okay, when baby we admitted of distress, he's a preterm having distress, surfactant deficiency was there. What are the clinical features? What are the clinical features you will see in the baby of hyaline membrane disease or respiratory distress syndrome? Anyone? What are the features I would see? So features, I told you, if the baby is a preterm, you will use something known as Silverman-Anderson score. Yes or no? Silverman-Anderson score for the preterm. And this baby is a term baby. Then you will use something known as Downey's score. है ना? पढ़ा कि नहीं पढ़ा? You use something known as Downey's score. The points of Silverman-Anderson score are, I told you, upper chest retractions, lower chest retractions, xiphoid retractions, nasal flaring and grunt. This is nothing but nasal flaring and grunt. So these are the 5 important points. Ishita, do you remember this? ओके 10 बार पूछ चुका हूँ, कम से कम 10 बार, अब 11वीं बार पक्का बता देना. So these are the 5 important points of Silverman Anderson score. That's in Downey score. If it's a term baby, we do. Retractions remain the same. And very important, grunt remain the same. No grunt, mild, moderate to severe, right? Yeah. Yes, right. Very good. So retractions and grunting will remain the same. RR, cyanosis and air entry. RR, cyanosis and air entry remains this is different. Okay. Okay, how do you diagnose? Anyone, how to diagnose a case of HMD? Diagnose कैसे करते हैं? एक बच्चा है, मान लिया बेबी है, जो प्रीटर्म था, मुझे लगता था उसको सर्फेक्टेंट की कमी है, राइट? उसको डिस्ट्रेस हो गया. हाउ डू यू डायग्नोस इट? एनीवन? ईशा, हाउ डू यू डायग्नोस अ केस ऑफ respiratory distress syndrome? So number one, either you can diagnose it clinically. Okay, clinical diagnosis, you can see the baby's gestation and this and that, clinical. Next comes the X-ray. You diagnose by the X. Very good. Isha is very right. X-ray कराओगे, that white out lung picture, that white out lung or air bronchogram picture is seen in X-ray only, and last is ABG. Last is ABG. But clinically and X-ray, these are the two important parts we should need to know. Yes, LS ratio is there. I'll tell you, Ishita. Yeah, that also we can get it done. So 5 more minutes, then this topic is over. We are already speaking for last 40 minutes. 5 more minutes, then this topic is over. Now X-ray. अब X-ray में कैसे क्या दिखेगा? Anyone? When the surfactant is deficient, when there is decreased surfactant, when there is decreased surfactant, the alveoli will be collapsed. There will be no proper lung formation because surfactant deficiency is there. So you will see a white out lung. So this is kind of a white out lung. And in the white out lung, this black, can we see that this black is nothing but the air bronchogram? Yeah, where you will see a white out picture, and that's nothing but a air bronchogram. Air bronchogram. What is this air bronchogram? ये क्या है? ये वाला, ये पेड़ की तरह, ये क्या होता है air bronchogram? इट इज़ अ ट्यूबुलर आउटलाइन. एक बस याद रखिएगा, एक खाली ट्यूब है और ट्यूब के बाहर पानी ही पानी है. एक ट्यूब में है फूक मारने के लिए, बस उसके इर्द गिर्द पानी ही पानी है. An air bronchogram is a tubular outline of an airway made visible by filling of the surrounding alveoli by fluid of or inflammatory exudate. मतलब ये एक ट्यूब है और इसके आसपास क्या है? It is nothing but inflammatory exudates. Yeah, inflammatory exudates. Tracheal deviation नहीं इशिता, tracheal deviation कहीं नहीं होता. ना mediastinal shift होता है, ना tracheal deviation होता है, वो कहीं नहीं होता dear. There is no mediastinal shift or there is no tracheal deviation. It's just lungs issue. Okay, lung. So air bronchogram, this one. So this is nothing but air bronchogram which is seen in hyaline membrane disease. Okay, very good. Done. Okay. Are you there with me everyone? समझ में आ रहा है कि नहीं आ रहा? ईशा, Faiz, Rushikesh, Shubhangi. This is a very important topic. This is one of the very important topic you must know. Okay, and okay, what is what is under 5 mortality rate? Anyone? Under 5 mortality rate क्या चल रहा है? हाँ, what is the latest under 5 mortality rate? Who will tell me? Faiz, Isha, Paramjeet, Shubhangi, Faiz. हाँ, क्या चल रहा है? एनीवन? यस, वेरी गुड. अंडर 5 मोर्टेलिटी रेट इज 39. अंडर 5 मोर्टेलिटी रेट इज 39. यस. एंड फैज इब्राहिम, हाँ, एसिडोसिस एबीजी में ब्रो, एबीजी में बच्चे को डिस्ट्रेस होगा, द बेबी विल हैव अ डिस्ट्रेस, राइट? लंग्स नहीं बने हैं, तो हाइपोक्सिया होगा. हाइपोक्सिया होगा तो CO2 बढ़ेगा हमारी बॉडी में, और उससे एनारोबिक मेटाबॉलिज्म जो है वो चालू हो जाएगा, एंड दैट लीड टू मेटाबॉलिक एसिडोसिस, एंड दैट लीड टू शॉक. Okay, done. So, ठीक है, very good. Yeah, I think that's it. We're gonna keep till here only. This class finishes here. It's only a 50 minutes quick session. We need to understand. Yes, भैया ना, हाँ. And जाने से पहले we have this amazing code. I want to show you the code first. And this second half we're gonna do in the night time. अभी नहीं करेंगे हम ये second half को. अभी हम खाली वो करेंगे, क्या बोलते हैं? We're gonna cover till here only. I'm just we're gonna end up the slide with a very pretty and beautiful quote. One second. So today's quote is, what is today's quote? Today's quote we don't have it here. I have to type it. So today's quote, most importantly, remember, be yourself and don't lose focus. Don't lose focus. Sometimes when you feel the topic is tough, sometimes when you feel the topic is tough, you divide the topic in segments. But don't lose the track, don't lose your speed, and don't lose focus. Every day it happens. Sometimes your speed can go very high and sometimes your speed can go little slow. So that's okay. That's okay. Okay, don't lose focus, don't lose your vision, just be yourself. If you want to study in the night, you study in the night. If you want to study in the morning, you study in the morning. Ishita likes to study in the night, I like to study in the morning, so it's my own way, right? So everyone is, self sufficient. Okay, so thank you so much for the participation. This was the part 1 of the hyaline membrane disease topic, where we have covered the clinical features, investigations, introduction, causes, and around 15 to 20 MCQs. Tonight we're gonna cover the other part, 8:40 p.m. We're gonna cover the second half of the RDS. Little bit is left in second part of the RDS, respiratory distress syndrome. And do join. And thank you so much. Thank you Faiz. Thank you Isha. Thank you Rushikesh. We have new names coming here. ठीक है? Isha says I don't like studying anytime. ऐसा नहीं है, सबको पढ़ना अच्छा लगता है। कभी तो पढ़ते ही होगे रात को, नहीं तो दिन में तो पढ़ना अच्छा लगता ही होगा। इट्स ओके। चलो, टेक केयर ऑफ योर सेल्फ। ओके एवरीवन, टेक केयर एंड प्लीज़ कम ऑन टाइम। इशिता, यू गाइस कम लेट, प्लीज़ कम ऑन टाइम। नाइट विल फिनिश इट एज सुन एज पॉसिबल। ओके।